I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Check, check, check. Check, 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 check. Check, 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 check.
Did you change where it was?
Check, 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 check. Yep. I don't remember which one it was either. Check 1, 2.
I mean, you're live here. Oh, I'm coming. Is he coming straight out of this? He's coming straight out of it.
What's he in?
He's coming straight out of my receiver.
Huh. Well, I didn't touch this one.
Well, then, that's fine.
So all we'll have to do is turn this.
Morning. No? Hi, good morning. I'm Dr. Kelly Suchman. Good to see everybody again. We're going to do things a little differently this morning, have a nice video for you, and do a PowerPoint before we get to our interviews. I want to introduce Dr. David Jackson, who's going to be participating with the interviews today too. Dr. Jackson, will you introduce yourself to everyone?
How are we doing? My name is David Jackson. I'm a adjunct assistant professor here. I'm here on Mondays and Tuesdays, so hopefully I get to see you guys. We work a lot with digital dentistry and CAD/CAM dentistry, as well as implant planning on the days that I'm here. I went to this residency program back in, God, seems like an eternity ago, 2011 to 2013. And then have been on as part of part-time faculty here since then. So look forward to meeting you guys.
Thank you, Dr. Jackson. Here are some great pictures of our clinic. So the clinic was redone. It's been several years since it was redone, but it was actually designed and finished by the same architect that does a lot of the dental offices in the Kansas City area. So it's meant to feel and look like a private practice. It's on the second floor of the School of Dentistry. These are the faculty members that are the attending faculty for the program. So as I've said yesterday, I'm the director of the program. Dr. Bhavika Tucker is a prosthodontist, and then you met Dr. Jackson. Dr. Bruce Cummings is a prosthodontist in the local Kansas City area. He comes in to work with the residents on Fridays, and then Dr. Stephen Prestovich is the oral surgeon that works with the residents on Wednesdays. So they get some really intensive experience in doing a variety of surgeries, including dental implant placement. And then yesterday you met Dr. Mary Walker, who is the advanced education program associate dean. So these are our goals here at UMKC for our program. We really want to refine and really advance your knowledge and your clinical skills in the practice of general dentistry. We really want you to sort of serve as the quarterback so that you're able to organize a multidisciplinary team. We want to definitely provide advanced training in basic and behavioral sciences, clinical sciences, and practice management. And then we want you to just be able to provide quality, comprehensive dental services, education, health promotion, and wellness for the patients. So you are going to function as the patient's primary and comprehensive oral health care provider from treatment plan to completion. And one of the most challenging aspects, I think, of caring for the patients that come to our clinic is the hardest part is doing the treatment plan. So we really spend a lot of time on gathering diagnostic information. You'll get really great at taking clinical photographs and doing digital wax-ups and diagnoses of various different viewpoints as far as doing things digitally and analog. We also want to develop practice management skills beyond what you have been able to accomplish in your pre-doctoral curriculum. And then typically we do a couple of community service projects throughout the year. COVID-19 has changed how we do that, so that looks a little bit different, but that is an important aspect of the program. So whenever you are a resident in our program, you're working under your attending doctor's license. So you do not need to have your own state licensure, and you're also covered under the UMKC liability insurance. So because of that, we do need to approve treatment plans and then have oversight of what you're doing and kind of do a final sign off because you are working under our license. So in order to optimize your learning, we do ask that you work with multiple faculty members, and we have a variety of faculty members that are available throughout the week. So this is our curriculum. Occlusion and functional aesthetics is a very big part of what we do and important to treatment planning. We do manage some TMD patients, and then there's a really great course on implantology that we take along with the advanced periodontics and advanced endodontics program. So we get that along with a biomaterials course in restorative dentistry. There's periodontal seminars. You'll get some more advanced training in endodontics. We have the same advanced education and endodontics director is teaching our residents some coursework, and then you have supervision of an endodontist or an endodontic resident for 1 day a week for a good part of the year. We have excellent surgical training, as I said before, with Dr. Prestovich. We have a clinical photography session in the summer and or fall that's really great at teaching you how to be a very good photographer. Suzanne Lacombe teaches that now, and she's taught photography internationally to different groups, so we're really pleased to have her. You'll get a variety of different practice management seminars. Every week we do a literature review. Some of it's classic literature, just foundational knowledge, and then there's also more current literature review because I don't know if you've noticed yet, but by the time that a textbook gets printed, that information is sometimes 10 to 20 years old or more. So we really want to teach you how to be a good lifelong learner and learn how to look at literature critically before you apply it to your patients. And then, as I stated before, we do the community service activities. So our digital dentistry piece, I say we kind of do it 3 different ways. So we need to teach you how to do it really well analog, because we realize that once you leave here, you may not have access to all of the digital dentistry pieces that we have here. We teach you how to mill, so you might be milling lithium disilicate or zirconia. You might be able to mill a PMMA provisional, but we also, starting last year, we have a 3D printer. So we have 3 different ways of managing care here, which I think is really awesome and exceptional. 1 day a week, you'll have direct supervision of clinical procedures by the oral surgeon. You'll learn to plan, place, and restore dental implants, treat medically compromised patients. We do have a good-sized patient base with a history of head and neck cancer. And then an important piece, too, is that you're going to learn how to refer and how to coordinate care with specialists. So these are some more photos of the AEGD clinic that is shared with the dental faculty practice. So some of the equipment that we have available, we have the 3-Shape Trios, which is an intraoral scanning and design software. And then we also have the OmniCam, CEREC OmniCam intraoral scanning. And then for 3D printing, the equipment that we have is called the NextDent. So we're able to print a variety of different things on this 3D printer. We can print long-term provisionals, we can print surgical guides, we can print denture try-ins, and we're kind of delving into being able to print dentures on this device. And then a lot of you are probably already familiar with milling. where you would do a single unit and multi-unit. You could do a PMMA provisional. That stands for polymethyl methacrylate, if you're not familiar with that term. So we can do both zirconia and lithium disilicate, or virtually anything that you can mill with Omnicam. We're using Nobel Clinician software primarily to do guided implant surgery, and then we have some other very nice devices like a Penguin or Ostel that would kind of give you a level of osseointegration of the dental implants. Other types of things that we have available, we have intraoral cameras that I really encourage the residents to use. And then we also have a diode soft tissue laser. So these are some of our numbers of our outpatient visits that are managed by the residents. So we see a fair number of patients, and like most dental offices and other programs, our numbers are down this year due to COVID. But typically we might do about 12, over the last 3 years, we've done 1,200 single multi-unit restorative procedures, lots of dental implants. I think typically per resident, we average about 15 implants placed per resident. Do a fair number of removable and complete and partial dentures. A lot of the removable is done in conjunction with some dental implants. So I think that's kind of an extraordinary experience that the residents get. And then a fair number of extractions. Here's a really great example of a before and after of some complex treatment that was done for a patient. So a wide spectrum of treatment from this to something as simple as a conservative indirect restoration. So we have a long history of having some really great graduates. As I said last night, I'm a 2000 graduate of the advanced education program, as is my husband. So we really enjoy staying in touch with all of these folks that we've gotten to know over the course of their residencies. And these are the current residents that you chatted with last night. Aaliyah Emery and Ricky Atchison and Afrina Khan. So you'll be seeing them again whenever we do the tours of the school. So here is a video about Kansas City and pictures from all of the advanced education residencies and clinics.
Good morning. Good to see everybody again this morning. Well, as Dr. Suchman mentioned, I'm Mary Walker, and as you can see on the slide, I serve as the Associate Dean across our residency program, so we'll talk a little bit about the programs we have here at UMKC, and then more importantly, the support that we provide for our AEGD residents. So as you can see, there's the residency programs listed that you just saw in the video. And then we also do have a couple graduate programs. One is the Oral and Craniofacial Sciences program. You could get a master's and a PhD, or the Dental Hygiene Education program, again, for a master's degree. And as you can see, one of my titles is serving as the director of the OCS graduate program, in addition to being an associate dean. So wearing a couple hats. All right, well, you've heard a lot about the program. There definitely, I'll say, AEGD has this program has a lot of strengths. One is excellent faculty, and you'll get a tour. You unfortunately can't be on site, but as you can just see even by the photos, it is an excellent facility. And clinic staff, and then the technology. So I feel strongly about the strength of the program in terms of leadership and what it has to offer anyone who decides to join us. And as Dr. Suchman mentioned, as a prosthodontist myself, I think, and having been a general dentist for 12 years before becoming a prosthodontist, I think one of the most important things that you're going to get out of this program is learning how to treatment plan. Whatever you do as a general dentist, if it's obviously it's easy to put together a treatment plan for single tooth restorations, but when those complex cases come in the door and you don't know where to start, that's the piece that you'll grow in your confidence, grow in your skills, and know when should I do it and when do I need to collaborate with a specialist. And as we talked about, the interactions with the specialty programs, that's a plus. Not everywhere you go do you have those kinds of opportunities. And typically we have a lot of interdisciplinary treatment planning sessions. With COVID, like so many things, some of those things have been lessened. And then interdisciplinary, other functions such as ethics and professionalism. We work hard to bring all the residents together, so you're not working in isolation. That's just not how you practice nor how you live once you're out in practice. Now, let's talk about support. In terms of annual stipend, you can see it's $49,000. That's like a salary. You would get paid at the end of the month, that portion out of $49,000 divided by 12. There's also a tuition waiver. You can see that's a partial tuition waiver. It's $10,000 annually that gets split across 3 semesters, as you can see there. Now, let's talk about the actual tuition and fees. Probably one important thing, one of the most important pieces of coming to UMKC is that no matter where you're from, you would receive Missouri resident tuition rate. So that's an important part of all this, because if you didn't, if you had to pay out of state, it'd be double what it is listed there. There's instrument fees, there's other things, but if you look at the totals, you can see the annual tuition and fees are about $23,000, and that's before that tuition waiver is applied. So your responsibility annually is about $13,000 after the waiver, and with the $49K stipend, I think we're a very affordable program. Other support that comes from my office would be every semester we will take care of your registration for any classes, taking care of all the forms, all the things you have to do. I went through prosthodontics here at UMKC, and one of the things that was so frustrating to me was how difficult it was to do that. Every semester registration was pretty much wrong, and so I just said, if I'm ever in a position to do this, I would take over, somehow do this, because residents, you're going to do this not for very long. You don't need to get good at it. Now, all right, if it turns out that we're a good fit for you and you're a good fit for us, how does the acceptance process work? Well, typically, Dr. Suchman would reach out to you with a phone call after TAE, and then if you're interested, we would follow up with an official email, And within 48 hours, we ask you to reply and officially accept. With that, you would pay $500, which is a seat deposit, but it would apply to your summer tuition. And then, because residents are employees, you would also complete an application, an employment application, and have to complete a background check. Between now and July, I think if you're a dental student, I think most of you are, make sure you maintain a 3 GPA. If you drop below that, next July you wouldn't be able to join us. So don't lose focus. And then in January, we'd send out a next steps guideline, basically letting you know there's various things that have to happen, requirements, deadlines to meet. And one of the things on there, we've always asked people to bring a computer, but now you've got to make sure you bring a computer that's webcam enabled, has a webcam. I don't think Zoom is going away even when COVID is gone. And meet those deadlines so you're eligible to join the program in July. So those are just important things. And I know all of you are very busy with dental school, but you don't want to miss any deadlines because then you miss an opportunity. In April, a resident manual comes out. Talks to you about the AEGD residency program, what to expect, requirements, and because, again, you are an employee, some of the HR requirements and guidelines. Well, what does it take to graduate? Maintain a 3, and we're talking about graduating from AEGD. You join us. Maintain all the clinical documentation. Learn to do that well. You'll do some presentations for seminars. We're really teaching you to do evidence-based and ethical clinical care decisions. Professional interactions with patients, faculty, and staff are expected. And really, you're coming here at one level as someone who's graduated from a dental school, and we want to see you progressively increase that knowledge and skills beyond a DDS, DMD. And with that, that's my contact information. Janae's contact information is on there too. There's certainly other places to get that. But you've got a busy day ahead. Enjoy it. Ask questions. We'll be asking you questions. Learn more about us, and we'll see you soon on Zoom. All right. Thanks, everybody.